Well, I'd like to welcome Wendy back to the video. She's come back from her extended sabbatical, and we're here to do a couple of videos today together. And I need your input on this, Wendy. This is going to be the best 5 things about running a hair transplant practice. All right, and we've sat around and talked about this. We only come up with 2. No, I'm just kidding. We can come up with a lot more. We get this. There's 5 things. So number 5, helping people that have had low esteem get more confidence. Can you think of anybody? I mean, you can think of a few people. Again, don't use their names, that have really had life-changing results from this.
I think the young guys are the ones that have more of a big impact. I think older people have gotten used to it. The young guys that started losing hair, it's traumatic for them. And there's one guy that's like 22, studying psychology. And when he called to me, he was not sure, if he wanted to keep on going to school, what to do. All his thoughts were all about the hair. 2 hours in the bathroom trying to fix it so people would not see it.
Crazy comb
over. Yeah.
Yeah.
We did 2 cases on him, and I saw him last week. I sat with him for 15 minutes when he came in.
Oh, he's completely changed. In fact, I did an interview with him, so we'll do a video on that at some point. But I think of him, and then remember the little boy from the Lynchburg area.
Oh, yes.
That wouldn't come out of the basement, and his parents came, and we did 2 or 3 cases on him, and after the second case he had a girlfriend, and then he had a fiance and a promotion, and then he had a baby.
Yeah.
And he alleges it's all from his hair transplant, but it just gave him some confidence.
Yeah.
We did a video, not just this morning, I did a video on a guy that's 45 who was having real marital problems, and whether the hair fixed his marital problems or gave him some confidence. He's a different dude.
Yeah. That's one of the biggest satisfaction of this work.
Number 4, repairing plugs. Plugs is the bad word of hair transplants. And so people come in and say, hey, put some plugs on me, doc. We don't use plugs anymore. They think of any of those bad words that the media doesn't like to use, and plugs should be right up in there with that. So the plugs were these things that back in the 80s or 90s, these little, almost like doll cornrow type things were put across people's heads, and they grew good hair, but they looked so unusual. And when somebody has one, all you do is you spend all day looking, what's going on with that head of yours? And so we get some guys that have had plugs that for 20 years people have been looking at their head, and all you have to do is just plant some new trees or new hairs to irregularize that, and then they look unremarkable. It doesn't fix everything, but that's a great thing, because people will tell you that people have been looking at them funny for 20 years, and now they're not doing that.
Yeah.
And right now, and actually there's a couple of people that still do FUEs with a plug. It's not FUEs, but they're doing plugs, and they're telling the victim or the consumer that it's an FUE, but it's a 2 millimeter derm punch, and it's just essentially small plugs. We see that very commonly in Northern Virginia, and so those are fun things to repair, because it just takes people from looking remarkable to making them look unremarkable, right?
Yes.
Number 3, really unusual repair cases. So when I think of this, I think of this guy that came from Australia who'd had a failed flap surgery. Now flaps, here's the diagram, were popular in the late 80s. I think I learned about them during residency. And he would take a flap of skin based on an artery right here, and in one step swing that thing over and make a hairline. But the problems is that you kink the artery and the hair grew the wrong. I mean, it wasn't a good idea, but people did them. And so we've had a few people like that have come in. And this one guy in particular came in, and he said he was a hair cripple for 20 years. He came over here from Australia wearing a hat, and here he is before, and we did a 3-step procedure where I think step 1 is we built him a hairline where it ought to be, and then a year later we came back and we took that flap out and put those hairs behind the first case, and the third case we added some final hair. And so he went from looking really odd to looking like a guy with finer hair.
Yeah, he said he was happy. After we finished with the third case, they went to Mexico, and then he was so happy that he was going to be able to go to the wife's social parties.
Yeah.
She was a designer,
Yeah.
and he never assisted, so he was happy because he had to wear a hat all the time.
Yeah.
Yeah, that was like.
And those actually require some thought. I mean, there's a lot of kind of bad hair transplants that we repair, but that requires real thinking of how you're going to fix some of these things. Same thing with some burn cases we've done, some working around some surgeries in the past. Number 2, repairing hair loss from cancer. So I don't know how many of you guys have looked at a lot of our videos, but if you go all the way back, you will find out that my daughter had brain cancer. And for about 5 years, my head was shaved. And, there are kids like Julia who get radiation to their head and then their hair doesn't ever come back there. And the usual problem is there's not enough hair to fix everything. But in some instances, there's a big bald spot or half the scalp doesn't have hair, but there's hair to work with. And so I was very upfront with people. I don't think anybody does a real good job fixing kids like that. And I thought my kid was going to need to have it done. So we started doing them mainly so I could practice up in case Julia needed a hair transplant. And I told the parents, nobody's more motivated to do a good job on these kids than me because I expected my daughter would need it. She ultimately didn't need to have a hair transplant. But these kids have gone through a lot of shit with their cancer, and their parents have gone through the same or more dealing with it. And so here are 2 examples of kids roughly Julia's age who had big hair loss before and then after surgery looking like a normal kid, everybody's not looking at their head anymore. And I'd say that's probably the most rewarding part of hair transplant surgery is dealing with fixing something like that, mainly because of the journey that our family's been through. And then the number 1 best thing that our hair practice gets out of working with people over the past 28 years and now 4,300 hair transplants is we get to know some people over the course of a year or 2 or 3, and really, I won't say we're buddies with everybody, but we work on a lot of interesting people from all walks of life and colors, nationalities, genders. We deal with some very interesting people, and Wendy's got the gift of the gab, and so people. You were saying somebody texted you, we worked on a number of years ago to ask you fashion advice about something. I'm not sure I would be doing that, but this is
people. We do transgender. We do all different types. Okay, so
for example, these guys will get some hair, and then they'll send us stuff. Like I can think of guys sending me pictures of girls they're going out with. I got a whole cabinet of stuff people give me, and so let me just pull out a couple of examples. Here's some kind of military patch from some dude that's been deployed someplace. Here's a bayonet that was taken off of somebody someplace, and we worked on the guy that took the bayonet. We have this flag that comes with a certificate. It was flown over Guantanamo Bay. Professional athletes, and I've got a bat hanging over top of my door here. A politician in Egypt who brought in some small pyramids. But it's really cool. We get to know people over the course of a couple of years,
Yeah.
And then I'm now in a band, and some of our patients come to see the band.
And some of your patients are.
Oh yeah, my singers.
A patient.
Both my singers are patients. Bass player's a patient. It's just fun. So this is a good job in that you get to know people over the course of a couple of years. Now, not everybody we hang out with. I'd be lying to you if I tell you that we hang out with everybody, but you do get to know a lot of interesting people. And unlike a dentist, you actually get to talk to the customer during the procedure. Unlike a dentist, you got to keep going back to. After a couple of years, we don't get to see them again. And so we're done.
Yeah. And then we don't see the results until like a year. So you do get, form a connection with the patient
Yeah.
until it gets the final result. And all of them feel comfortable to call us and say, hey, this is what my hair looks like right now. I get pictures all the time on my cell phone sending me like, this is how it looks now after 5 months. So there's patients too that give me like, you guys need to put, this is my whole year journey with my hair transplant.
Yeah.
We have hairstylists that he sends me every 15 days how he looks.
Yeah.
Yeah.
Yeah. So that's the top 5 things that are good about a hair transplant practice, and ours in particular. We do this all the time. We'd love to have you come to the office. Thanks.